I want to explain an often frustrating and confusing concept in clinical medicine that's called obtaining a prior authorization or prior auth. When you come into the doctor's office, oftentimes we will order tests, diagnostics, or sometimes procedures or surgery. These are all services that we have to get permission from your insurance company so that they will cover these tests for you. The insurance company does this under the guise of trying to ensure that cost-effective care is being delivered. Unfortunately, often it just ends up delaying or sometimes even denying the care that you need. So how this works is when you need a test or a procedure, the medical office will submit a request to your insurance company. A period of time then passes. Sometimes they don't get the request, sometimes they lose it. Sometimes we spend a long time on hold trying to get through to them. It can be a very confusing and frustrating process. Ultimately, they'll make a decision whether or not to approve the treatment, but oftentimes it's declined, and sometimes for reasons that aren't well explained. If that happens, then we have to do what's called a peer-to-peer. This is when I actually have to call the insurance company, I spend time on hold, and I talk to another doctor of their choice. Sometimes it's a retired doctor who's not really familiar with modern clinical practice. Sometimes it's someone who's not even in the same field as I am. Oftentimes they don't have a clear understanding of your clinical picture and decline to provide care based on technicalities. Ultimately, we're your advocates. We try to go to bat for you so you can have the procedures and treatments that you need. But there's a huge time delay that occurs with obtaining any prior authorization, and it takes a lot of work on the medical staff to get those things accomplished. You do have a role in this process, which is you are able to call your insurance company and advocate for yourself. You can check what things are covered under your insurance plan. Sometimes you can find out before we can as to what's going on with your request. The prior authorization process can be very frustrating. Patients often think that what's going on? Why hasn't my test been ordered? Why hasn't my surgery been approved? I really need these things. They take that anger out on the office staff and the physician. But we really have little to no control over the process. We do what the insurance companies ask us to do, and we submit the paperwork. The ball's in their court until they deny it, in which case we have to appeal. Understanding that there is this process behind the scenes, I think, is really important. Hopefully it will help alleviate some anxiety that you may be having. And just know that we're on your side. We're trying to do what's best for you and trying to get you the care that you need. There's a huge administrative blockade to doing that in almost every case, even for simple things such as lab tests, x-rays, CTs, anything that's diagnostic, and then especially surgery. And follow me for more.